Joining us now is Dr. Denise Johnson, the Chief Medical Officer at Meadville Medical Center. Welcome back, Doc. It's always a pleasure when we talk.
Thank you.
When you first came to Meadville Medical Center back in the 90s, I think everybody knows you were an obstetrician, and Meadville Medical Center won awards. And let me ask you a broad question. In recent years now, a number of the hospitals in the area have closed their OB program. Why? What's going on? Why does the hospital need to do that?
Well, there are multiple reasons. One of the reasons is that it's expensive. It's expensive to care for those patients, and the reimbursements, especially in our area, aren't great. And so, it's not a way for hospitals to make money. Hospitals do lose some money there. But also in our area, our rural area, it's really difficult to recruit well-trained OBGYNs to the region. Many people want to join a large group because they don't want to be on call every other night or every third night. That's
Sure.
really tough on your lifestyle.
I remember probably about maybe 8 years or so ago, Greenville closed their OB program. A few years go by, Corey closed their program. Now here recently in the news, Titusville, and I saw it yesterday in the news at Clearfield Hospital. Now Clearfield's not immediately in our neighborhood, but it's in the region, and they're closing down. When that happens, talk for a second about the folks who are in process. That's got to be very stressful.
It can be because first of all, if you've got someone that you're used to seeing, you form a bond with your OB, and you want that person to continue. But you also like the convenience of having obstetrical care in your neighborhood. When something happens in the middle of the night, you don't want to have to travel. So that can be very stressful on someone who is waiting for their delivery.
I heard the recommendation that came along with the news about Titusville's program closing to take your care to St. Vincent's and Erie. Now, my first reaction was Titusville to Meadville, 25 miles, something like that. Titusville to Erie, 40 miles, further anyways. And hey, how about coming to Meadville? I think that's a great option for folks even to think about. If that's not been thrown on the table, let's throw it on the table. What do you think?
Well, I think, certainly patients are going to need to make a decision about what's best for them. You certainly want to have some continuity in terms of people that you've seen and who've taken care of you. But there's also the convenience of having your care close by, especially when you need it for those emergencies. Meadville has a terrific program. We have been really fortunate to attract very high quality obstetricians and gynecologists to our area. And so we actually have 6 practicing obstetricians now and 7 gynecologists, one who does just gynecology. And as you've noted before, we've won a lot of national awards for our obstetrical care. For gynecology, we do all of the minimally invasive laparoscopic surgery. So we've got a great program, and our hospital is really committed to providing the obstetrical care in our neighborhood. It can be difficult at times, but we think we have a great program, and we think that the people of Meadville really need that, and so we'll provide it.
I'm saying we, I don't speak for everybody, but we were very proud when Meadville Medical Center was recognized nationally for the quality of care in our obstetrics program. I was in the lobby one day organizing the actual trophy that came, and a person walked up and, "What is that?" I said, "That's the Heisman Trophy for hospitals." "Oh, what's that about?" I said, "Our obstetrics program is the best in the country." And and not in the top 100 or not in the top 5% or whatever, but the number one, when they first came out with that award from Premier, the Premier Award for Quality, there weren't categories of large hospitals and teaching hospitals and whatever, and they've added that since then, but that was the number one hospital in the country, period, for the quality of care. And that wasn't just once, that was 3 times.
That's right.
And you're still here. The folks who helped win that award are still here. Our nursing staff, the whole program. It's not just the doctors and not just the nurses. The facility is designed for the way the program works. Maybe if you could talk about that for a second. The whole package.
Yes, we have an excellent program, as I said before, and anyone who's been here and had care here can tell you it's a completely different care experience. I think because we're in Meadville and we're taking care of our friends and our family, there's a different level of care that you get, a different level of compassion. So everyone's all in for you, taking care of you, and it's a great feeling. Plus, our staff is highly skilled. We've got great physicians and nurses and hospital staff to take care of our patients. So everyone together, they do a really great job.
I've been around long enough to remember when we first went to LDRP, that you have your labor, delivery, recovery, and the postpartum all in one room. And it was like the customers at the time, we did some survey work with the customers. We don't know what that is and what's that. It was very, very innovative and sort of in front of things. So it isn't always even. Let me say it this way: it was more anticipating what would be the best program out there for people. Let me ask you: I think that's proven to be true. I mean, I think that's worked out, and that was going back to the '80s, actually, whenever that was getting off the ground.
Yes, things have changed quite a bit. We really are focusing on the family care. So the patient comes in and stays in the room the whole time, even for delivery. So there's not all that back and forth, and so there can be a spouse or family member staying with the patient. And then the baby stays in the room with mom all the time. So that's very different from how we had done things before. We've also been complimented on our breastfeeding initiatives and baby care as well. So like you said, it's the whole package, not just the delivery.
I went through that myself. Well, I didn't. My spouse went through that. We went through that back in the late 80s, early 90s with our kids that are now in their 20s, and understand it very well from having firsthand experience. Well, again, my spouse, not me, but having very much involvement with that back then, and it was a tremendous experience then. Well, thank you, Dr. Johnson, for kind of keeping us up to date. When things come up in the news, I appreciate your flexibility to address this topic. It was, quite frankly, troubling news, and I think it's helpful to kind of help people, process that.
Well, thank you. My pleasure. Thanks, Dwayne.